Hi, this is Stephen. It's post-op day 8 from my jaw surgery last week. It's Thursday morning. The surgery was a week ago, late yesterday afternoon. I had a upper jaw advancement known as a Lafort 1 maxillary osteotomy. I had a sliding genioplasty to compensate, where they bring my lower chin forward to match the advancement of the upper jaw, and my lower 2 wisdom teeth were removed. My last video was 3 days ago. Since then, I think the swelling has continued to decrease. The bruising has started to go away, although I still have a good amount, especially, as you can see, on the lower chin and neck. The main concerns, however, are still the numbness. And these are very concerning. This numbness is very concerning for me. There are 3 areas of numbness affected by 3 different nerve distributions. The first, and the most concerning, is the numbness I'm having along my lower chin, left lip, and front lower teeth. This is usually due to an injury to the inferior alveolar nerve. It could be a stretch injury, it could be the nerve was cut or damaged, or so forth. This is most concerning to me because I have absolutely no feeling in any of those areas down here. Somebody could put a cigarette on my lip and I would not feel it. I have no feeling to light touch. I have no feeling to vibration. No feeling to temperature. Which means that there's been some sort of nerve injury which has either caused the nerve to shut down completely or the nerve has been cut. So that is very concerning to me. I had my first follow-up appointment with the doctor 2 days ago, and he was surprised by this numbness. The nerve is the inferior alveolar nerve, and risks for injury to it are removal of wisdom teeth, such as the one I had removed down there, and then obviously the sliding genioplasty. I'm not sure which of those 2 procedures injured this nerve, but one of those did, and it's concerning. Because I don't have any sensation at all, the prognosis is not nearly as good as if I had some sensation. So whether or not I get this feeling back remains to be seen. It's 8 days after surgery, and so I'm quite a bit down right now that I'm not feeling anything there. Not being able to feel your lip, your teeth, or your chin at all is quite disturbing. The second area of numbness I'm having is the entire left side of my face, nose, left upper lip, and left lip have markedly decreased sensation. There's sensation present, but it's decreased. And this is likely due to a stretch injury or bruising of the infraorbital nerve during the upper jaw advancement. This nerve injury is more expected than the nerve injury to my lower chin. The fact that I do have some sensation, I can feel it when somebody touches me or put a piece of ice against my skin. The fact that I do have some sensation is a very good sign for nerve recovery. It still feels very weird. It feels like whenever I talk or whenever I move my facial muscles, that on the left side my skin is all leather and thick and swollen and puffy, so it feels very uncomfortable. But at least there's feeling there. That's a good sign. The third area where I'm numb is on the roof of my mouth, as well as all of my upper teeth and my upper gum. All of these areas are also completely dead. No sensation at all. So it's really weird because my upper teeth and my bottom teeth, at least the bottom teeth in the front, are completely numb, so when they touch each other, I feel like I have fake teeth in there touching each other because I don't feel it. It's weird. But the numbness in the upper roof of the mouth and the teeth is fairly expected after the type of jaw advancement I had, and commonly returns to some degree. So that's not as concerning either. The most concerning area, which has got me concerned and worried, is the lower lip and chin. Other things going on are I have a lisp, if you probably have noticed by now. When I say certain sounds, like any word with an S, it doesn't come across as it used to last week. And I think the reasons for this are twofold. Number one, the roof of my mouth being numb. I don't have the tactile feedback about how much pressure I'm putting on when I make these letters. Pressure I'm putting on the roof of my mouth by my tongue, that is. And also, the roof of my mouth has been slid forward several millimeters to correct the underbite. And thus the tongue has to relearn how to talk, has to learn to go into a new position. I'm told by my friends that I'm improving day by day. The swelling is still present, although it's decreased. I still feel like I'm really swollen, especially in the upper lip area and the left side. But a lot of that sensation of feeling swollen may be due to the numbness I'm having there. The bruising is still present, as you can see in the lower chin and neck. It's improved a little bit, but it's still got a ways to go. I go back to work in 4 days, so hopefully most of it will be gone by then. Eating is going well. I'm on a full liquid diet, trying to eat about 1,500 to 2,000 calories a day. I'm eating a lot of soups, protein shakes, Ensure, smoothies, Gatorade, and I think that's about it. So that's going fine. I'm losing weight, but that's to be expected. I'm losing less than probably would be expected, I think. So that's a good thing. I go back and see the doctor a week from today, post-op day 15. I'm just really hoping that the sensation in the lower lip and chin does start to return by then. We'll see what he has to say on it. Other than that, I want to really reach out and thank my friends and family who have been around and have been supportive the last week or so. It's a kind of a tough thing to recover from, especially when you've got all the concerns, when one has all the concerns about the numbness and so forth. So I really appreciate my friends and family being there and helping out. That's it for now. I am going to sign off, and I'll make another video in a few days. Goodbye.